Brumell.
You're listening to American Medicine Today, presented by the Bonati Spine Institute. I'm Kimberly Brumell, joined by Jeff Wagstaff, Aaron Jacobson, and world-renowned orthopedic surgeon Dr. Alfred Bonati. Now, on the line, we have Jared Hyman, founder and product visionary of CrownMed. Now, CrownMed is harnessing the wisdom of crowds to help solve the world's most difficult medical cases quickly and accurately. So thank you for joining us on the line today. Thank you, Jared, for being here. I find this fascinating. So why don't you just get right into it? How does this work?
Well, on CrowdMed, if you're a patient and you're suffering from an unsolved medical mystery, you can submit your medical case on our site, and we get several dozen of what we call medical detectives to collaborate on solving the case.
Okay.
So it is a crowdsourced medical diagnosis and treatment site where we harness crowd wisdom to help crack cases that perhaps individual doctors aren't able to crack on their own.
Jared, are these medical detectives, are they doctors, nurses? Tell us more about who the medical detectives are.
Sure. We have a community of several thousand medical detectives. About 250 are currently active on the site, and 60% of them either work in or study medicine. So it is mostly a medically oriented crowd.
Okay.
Those include doctors, nurses, med school students are actually a very active group on the site, mostly third and fourth year students, residents, plus people from alternative medical philosophies, like chiropractors and acupuncturists even, although the majority are either practicing physicians or medical school students. And the other 40%, our non-medical crowd, are people that have expertise around particular illnesses but might not actually have a medical background. So, for example, patients who have suffered from a particular illness and often know more about that illness than a lot of doctors do.
Wow. What types of medical problems are they solving?
Well, very tough cases. Our average patient has been sick for 6 years.
Okay.
They've already seen 8 doctors. They've already incurred over $50,000 in medical expenses.
Wow.
So these are not colds and flus.
Right.
These are usually multi-systemic, chronic, undiagnosed or unsolved medical conditions. So we really try to take on challenging cases where individual doctors just couldn't figure it out, and the patients really need an alternative place to look.
Why don't you tell me a little bit what type of symptomatology are usually these patients bringing to you guys?
Well, every case is different. We've had over 350 cases on the site since we launched it about a year ago, and they're like snowflakes. No two are exactly alike. These are usually things, though, that don't lend themselves to a simple diagnostic test. So it's not the kind of thing where a doctor can just do an MRI and see exactly what the issue is, or do a blood test and see exactly what the issue is. So the one thing that they have in common is they're all difficult to diagnose or difficult to solve cases, but they could include symptoms ranging from it could be fatigue, it could be chronic pain, but again, things that don't lend themselves to a very simple diagnosis and treatment.
But usually, what type of complaints? Is just pain the main complaint? Is just fatigue the main complaint? Or is just some sort of memory problems? What is usually in around 60-70% of the load of individuals that they cannot be helped by physicians?
It's really hard to generalize because, again, no two cases are the same. I can't say there's a common complaint that would affect 60 or 70% of our patients because they really cover the board. The one thing they have in common is the patients have been sick for many years. They've seen many physicians, and they can't get a diagnosis, but that's probably the only common thread.
I see here that it's saying CrowdMed members have solved over 200 challenging medical cases that have stumped individual physicians for years. I find that amazing.
We have a pretty good success rate. So despite the difficulty of these cases and how much they've foiled the medical system, over half of our patients tell us that what they learned at CrowdMed brought them closer to a correct diagnosis and cure. And that's closer than the 8 doctors they'd already seen on average. So we think the crowdsourced approach has a lot of merit to it. And by getting dozens of people with medical expertise to collaborate on solving a case, we can almost without fail come up with better answers than even the smartest individual physicians.
When you talk about crowd, I'm trying to make an idea in my mind of what type of cases are. For example, when you talk about crowd, I think it's very, very clever one idea. If I have a type of symptomatology that no other physician can give me an answer, and I go to a crowd type of individuals that they are patients, that they have the same symptomatology, and they are for years trying to correct this, and they get together those. Now I can understand that those people can talk and say, okay, look, I have a headache. Yes, I do have a headache. I have a pain on my arm. Yes, I do have pain on my arm. I lost my memory. Yes, I lost my memory. So they put the whole thing together. Now when they put the whole thing together, then they can have probably some type of a diagnosis or some type of a direction that can be directed in by physician. Is that the concept that you develop?
I think you hit the nail on the head. I mean, the concept, in short, is that the many are wiser than the few. And if we can get lots of people, our average patient gets about 50 medical detectives to collaborate on their case. If we can get lots of people and have an organized way of aggregating their collective knowledge and wisdom, and very importantly, separating signal and noise. That's the hardest part of what we do technically is knowing and having a mechanism for separating the good answers from the bad, and highlighting only those diagnoses or solutions that the crowd seems to have consensus around, while discounting the kind of silly suggestions that we inevitably might collect when we get 50 people looking at a case. But if we do a good job of that, and we tend to, then the crowd comes up with very good answers. And there's a lot to be said for collective wisdom versus individual expertise.
Yeah, I understand that. I think it's a very clever concept. If you get the people that they seek to collaborate and put together something, you may develop even different type of syndromes or something like that. But the point is, when you do that, for example, you said that you have 200 plus cases that they were brought to light and that they helped these people. Can you give us one example, one case that I can put in my mind how this work, or what type of a case was?
Sure. I'm happy to highlight one for you. I'm actually going to pull my notes right now. But and again, they're all different. But I can give you a couple of success stories that we're proud of. One is, and by the way, every patient on our site is assigned a pseudonym. So Pablo is the name we assigned to a 78-year-old male in the UK. And he told us that for about 34 years, nearly half of his life, he was experiencing unexplained muscle pain, his face, his upper body, his extremities, along with fatigue, malaise, mental fogging when his pain was at its worst. And he told us that by the time he submitted his case on our site, his symptoms had become so severe that they had really significantly changed his lifestyle and were worsening every day. And most ironically, Pablo is a physician. So this is actually a doctor who is submitting his case on behalf of himself. And we ended up coming up with after running his case on our site, the number one diagnostic suggestion that our crowd produced was fibromyalgia. And as a doctor, he had self-diagnosed himself with ME, which you might be familiar with. And he had self-diagnosed himself with that for years. But since there was no cure for that, he had decided to just kind of grin and bear it, in his own words. But after getting the CrowdMed diagnosis, he requested a prescription for an analeptic that's found to be helpful in fibromyalgia. And it worked. And he said it gave him considerable relief from his symptoms. And he feels that this is confirmation that the CrowdMed diagnosis was correct for him. Again, that's just one example out of many.
Very nice, very nice. At least it's a new idea, it's a new concept, and everything that you are trying to put together is bringing people who has the same symptoms that they're being lost probably on the medical field is true. Fibromyalgia is a very bad syndrome because affect a lot of areas on the body, and is pain on the muscles and all this. Well, but the problem is, usually in the medical practice, when you start to tell the doctor, I hurt in my nose, I hurt in my toes, I hurt in my mouth, I hurt in my shoulders, the doctor doesn't have time to that, and then discard you, and then you become an individual that is not properly diagnosed. So the concept that you have, I think is great and is amazing.
Thank you very much,
Thank you.
Jared, for participating. If folks want to hear more, they can go to crowdmed.com and hear more about that. And gosh, just for myself, how does one become a medical detective? Is there a place online that they can apply to become a medical detective?
Oh, absolutely. They just have to visit crowdmed.com.
Okay.
We have two calls to action on the homepage. One is to submit a case.
Okay.
And the other is to solve patient cases.
Wow.
If you want to become a medical detective, simply click where it says help solve patient cases. It takes 2 minutes to register. It's free.
Perfect.
And you can immediately start reviewing the cases we have live on the site.
We appreciate all your time, Jared. Thank you so much for sharing what CrowdMed does with our listeners. You are listening to American Medicine Today on News Radio 970. If you or someone you know is suffering with headaches, back, neck, or leg pain, reach out to the Bonati Institute at 855-267-0482. After the break, we'll hear what's new in American Medicine Today with Alfred Bonati, MD. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 94% patient-reported success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit us at bonati.com.
All my pain is gone. Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.